Hi and welcome all. I am Maitri, a counselling psychologist at Dr. Bakshi's Healthcare. We have Dr. Jain, who is a psychiatrist in Dr. Bakshi's Healthcare. Welcome, Dr. Mini.
Thank you, Maitri. Hello, everyone. I am Dr. Jain. I am a consulting psychiatrist.
So today, I have Dr. Mini, and we are going to talk about depression. Dr. Mini will be enlightening us with the topic what is depression. So we see in everyday lives that people are using the word depression very casually. Somebody who is just very sad, or who is somebody who is just upset, people take it as okay, that person is having depression or that person is having depression. So people are using the word depression very casually. But today, Dr. Mini will be enlightening us that what actually is depression. So, Dr. Mini, can you tell us what actually is depression?
Yes, you just rightly mentioned, Maitri. आजकल क्या हो गया है? Everybody is using depression very loosely. For example, if I'm having a bad day and I'm stressed, people just call it like, okay, I'm depressed. Or sometimes like we set some goals for ourselves, we are not able to achieve that, and then also people say like, okay, I'm not able to achieve it. It is failure. It is not like depression, or maybe it is something else. But depression, but nowadays we are using depression very loosely for everything. Whenever we are stressed or hurt or feeling low or feeling irritated, everything is termed as depression.
Yes.
Let's understand what actually depression is. Depression, it's not a term or it's not a symptom. It is a clinical disorder. It is a illness, it is a disease, and it has many components to it. Let's understand, like when we call someone has depression, how do we tell, okay, this is depression? There are 2-3 things which are covered. Only then a person is called to have depression. The signs and symptoms, the duration, and then the functional capacity of a person.
So, Dr. Mini, can you tell us how can a clinical psychologist or a psychiatrist diagnose that person is having depression?
Alright. See, like I told you, there are 3 components: sign symptoms, the duration of the sign and symptoms, and then the impairment because of it. So if we talk about sign and symptoms, there are 2 sets of sign and symptoms which are seen in a person who is in depression. They can be categorized as like the major symptoms and minor symptoms. In the major symptoms, there are 3 categories. Depression as such, it is a mood disorder. So the first and foremost important and major sign of depression is a person having low mood. Persistent low mood, like a person is sad continuously for a defined period of time. That is when we say, okay, the person is having low mood. The second major symptom which we see in a person who is in depression is loss of interest in activities. For example, like I used to like going for walks, singing, spending time with my friends and family. Now I don't feel like doing it, or I don't feel that kind of a pleasure in that. So that is the second important symptom which we can identify. And then there is third thing, that is lethargy. Like we feel continuously very heavy in our body, very tired, we don't feel like getting up, or we have to drag ourselves all throughout the day. These 3 are the major symptoms which are seen in a person who has depression. Besides this, there are other many minor symptoms which you must have heard or seen in a person going through depression, like changes in the appetite, sleep patterns, maybe negative thoughts, self-harming thoughts, suicidal thoughts, all of guilt feeling, self-blaming. All of these things can also be a part of depression.
So you just mentioned that feeling lethargic is one of the symptoms of depression, diagnosing depression. How can we differentiate, like if a person, what if somebody who does not have depression, how can we differentiate?
That is what I'm saying. See, depression is not I told you about the major symptoms and few minor symptoms. Major symptoms में से भी अगर the person is lethargic does not mean he has or she has depression.
He or she has to meet all the criteria to be, all the symptoms or any particular number of symptoms should be present.
Yes, at least 2 of the major symptoms should be present.
Okay.
For example, like usually depression has persistent, pervasive low mood. Like a person has a persistent sadness. It has to be at least for few weeks, and it should be pervasive. It should not be situation dependent.
What's the duration?
At least 2 weeks.
2 weeks.
At least 2 weeks. All of these symptoms should continue, or at least 2 of the major symptoms and few of the minor symptoms should continue for at least 2 weeks duration for us to call a person to have depression. And there is one more thing which is very important. Besides all of these signs and symptoms and the duration, there should be a functional impairment also. Like these symptoms should be severe enough so that a person is not able to meet the daily functioning, daily capacity, day-to-day needs of his or her life. That should also be there.
Okay. So when a person is diagnosed with depression, he or she they have that mindset that okay, now I'm diagnosed with depression, I have to live with it for my entire life. That once I'm diagnosed with depression, it cannot be managed or cured. I have to live with it throughout my life. So is there any treatment plan out there, or how can we manage it?
See, Maitri, yes, many a times people think that yes, now I have got diagnosed with depression and I have to live with it. No, it's not like that. It's not at all like that. Depression, it is very much treatable, very much treatable. There is one analogy which I always give my patients. Stress and depression, you can differentiate it with a very simple example. Every one of us have fever, like common flu with changing weathers and all. So whenever we have flu or signs and symptoms of cough and fever, we know what to do usually. We talk to our family, or maybe we just buy over-the-counter drugs for it, like a paracetamol, or maybe we take steam inhalation and do few things, and it gets resolved within a week or so, or something like that, of proper rest and diet and just a few simple things which are present at home. This is a stress. This is similar to stress, like a normal flu is similar to stress. Yes, you can manage it with the help of your friends, your knowledge, or doing few things, changing something in your routine. Yes, you can very well manage the stress. But depression per se, it is like pneumonia. Do you see? It has a reason behind it. Yes, the infection is severe. It takes time to heal. A person has to take proper rest, proper care. The most important thing, the person has to go to a professional to seek help about it, to know what is to be done. And in that treatment phase, there will be a time when the person will ask to do some rest, which means the person will not be able to fulfill the responsibilities which is there on the person. Then yes, maybe in a month or 2 the person will heal and will come out of it. This is depression. It is a illness, it is severe than stress. You cannot treat it by yourself, you have to seek a professional help. And this will mean that the treatment process, when the treatment will go on, if you follow the steps of the treatment, you will be healed, you will be treated, you will come out of it. But during that time, you have to understand that yes, you need to rest, which will mean that okay, you will not be able to fulfill few of the responsibilities. That's okay. Second thing, in pneumonia, it's 1 to 2 months, and in case of depression, it usually, depending upon the severity, depending upon the social support a person has, depending upon which episode of depression it is, the time duration can vary. But a simple first episode of depression can usually be treated in a duration of around 6 months.
6 months.
Yes.
Okay. So, what do you want to tell to those people who sometimes or usually take anxiety or symptoms of anxiety or stress as depression? I mean, there's nothing in between, no stress. They just diagnose. They just say that okay, I have depression. So how can they differentiate between anxiety or depression?
Like how can, if someone is suffering from
Anxiety, but they say that okay, I have depression.
See, there is a difference between anxiety and depression. As I said, depression is a mood disorder. The most important part which you will see when a person is depressed is the change in the mood. Either low mood, irritability will be there. And along with that, the cognitions of a person, like the thinking, will be negative. Negative, like, for example, again a very simple example, glass half full nahi, half empty hi dikhai dega. That is what is depression. It makes your perspective negative. And in case of anxiety, the person may or may not experience low mood. It is not a thing that okay, this should be there. And in anxiety, if I have to change this thing only, like this glass wala example, anxiety में ऐसा होगा कि ओह मेरा ग्लास कहीं कम तो नहीं है, मेरा ग्लास कहीं कम तो नहीं है. Do you see the change in the thoughts in these two things? The depression will be a negative perception, and anxiety may be worrisome thoughts, or maybe some fidgety thoughts will be there. And mood may or may not be changed because of that. But in depression, the mood, the low mood will, it's like always a part of that. And it is, most of the time it is pervasive. It does not change with the situation. In anxiety, maybe like when a person is in a calmer situation, or a person knows okay, this thing is not triggering the anxiety, the person can enjoy things, the person can have a good mood. It fluctuates.
Okay, thank you. So I have another question. Like somebody who has a member in their family who is going through depression. How can after they take the treatment, how can they some techniques or anything you would want to tell that they can help them family member to manage their symptoms, or help them at home to not the treatment per se, but any kind of activities or techniques they can use to be with them at home.
See, for family members, usually what I have seen, like when a person is undergoing depression, the person is able to understand what it is. But the people around the person, like the family and the friends, most of the time they are not able to understand what is happening to the person. Because depression is a very much thing which is internal. Like you can feel it, you cannot show it. Yes, you can show it with change in your behavior, but that is for the other person to observe. But otherwise, there is nothing which is visible outside of a person.
Because people try to see the okay, he's happy, he's smiling. He cannot have depression.
Yes.
But people have this what would I say? It's a myth that if people is somebody who is very sad, who is crying, can only have depression, right? So would you like to?
It's not like that. Not at all like that. A seemingly happy and cheerful person can also be in depression. In fact, I have seen like there is a term we use, high functioning depression. People who are in a significant severity of depression, still they are performing well in the mostly in the career fields, like their jobs. They are performing very well. But still they are in depression, and many a times people say like the person is achieving everything, how could the person be in depression?
And they take it their symptoms and their health for granted, and then it eventually increases, the symptoms increase and then it goes on.
Yes, depression is very much a very internal feeling and the thoughts which are there associated with it.
So what all techniques, can you brief us about the techniques in treatment that you give to your patients?
See, first of all, like for the family and friends to identify,
Yeah.
it's usually when a person is in depression, you will see a change in behaviors and patterns of a person. That change you have to notice, and the change which is persistent for some time. This is what you can identify. For example, like you might have also, these days, the depression is also very common thing. Nowadays, I think if you have a group of 5 or 6 close friends or something, you will be able to identify that okay, one person is going through something.
Yeah,
It's
the
that
behavior
common.
is changed, and
Yes.
he or she is acting in a very different way.
Yeah, can you tell me, Maitri, like if you have observed something like that, how will you identify if somebody has certain kind of a thing going on?
Yeah, so I feel that one, that loss of interest in the activities that we usually do. Somebody who likes to go and play, or somebody who likes to paint, they just don't enjoy it anymore. Like, and somebody who loved going to the college, and going out with friends, they don't enjoy, they don't go anymore. They just want to lie in their bed and just not go out and socialize anymore.
And also a very important thing is self-care also gets deteriorated when a person is in this. For example, a friend who is very much likes to dress up, likes to shop, is very outgoing, and suddenly the person is seen maybe wearing pajamas. I'm not saying like it's anything wrong that you wear it, but like for a person who used to be like to dress up and wear nice things, put on makeup and everything, and now that person you are seeing like just wearing pajamas, going out, and that also you have to ask the person 10 times, okay, let's go, we have a plan, and you have to drag that person along. So once in a while it's fine, but if it is persisting like for few weeks, then okay, there is something.
And another thing would be like, even if the person is coming and forcing himself or herself, coming out of bed, dressing up, going out, but then eventually he or she is not happy. They're feeling suffocating. They are where they used to enjoy so much, and now they're feeling very suffocating, and that they just want to run away from that place. That is another thing, but that is something that people cannot see.
Yes.
Right?
Yes. And also if we talk about Indian settings, middle class families, young adults living with their parents, this scenario has become very common these days, because now the young adults who are in the marriageable age, they have this stress of of the career, of finding a right partner, and then fulfilling the responsibilities of the family. All of this becomes very overwhelming at times for the young individuals these days. Like I'm seeing a lot of people who are going through these things. In these typical cases, what happens, what I have seen, the sleep cycle reversal is happening just to avoid all of these things, just to hide the low mood and lack of interest. The young adults, what they are doing, they are waking up in the night time, sleeping the whole day. And so that here the identification of mood changes and behavioral changes, many a times family is not able to pick up. They just keep on critically commenting the person that ये तो सोता नहीं है, ये तो उठता नहीं है टाइम से, ये नहीं कर रहे, वो नहीं कर रहे, तो वो add on और emotional stress and burden में add कर देता है, like the critical comments from the families.
Definitely.
You must have also seen this
Yes,
happen.
in my clients, definitely.
Right? So here the parents should be, this is like for parents or any adults who are living together in a household, please be aware. If you are seeing a change in the sleeping pattern of a person, talk to that person. Talk to the person that how you feel, what is happening, what is going on. These simple questions, they make a lot of difference. But we fail to ask these questions.
Actually, I think people don't realize that they take it for granted, I would say. That ये पूछने से क्या ही हो जाएगा. But for somebody who feels very lonely, who feels worthless, asking how are you means a lot to them. But somebody who thinks somebody who is not going through anything, they are they are fit and fine, they think that okay, why do I have to ask, how are you, पूछने से क्या ही हो जाएगा. But for somebody who genuinely is feeling worthless and lonely, that how are you would mean a lot to that person. Can I have a question? Can stress and anxiety leads to depression?
Yes, they can. They very well can, because if we understand, there is a biological mechanism occurring behind depression. Depression is not something, it is not a behavioral thing. It is not that a person is not able to cope, that is why the person is in depression. These, it is an illness. Okay, it occurs because of something, right? So depression occurs, there is a neurochemical in the brain called as serotonin, which is like a positivity chemical in the brain, like which keeps us happy, which enables us to enjoy things, draw pleasure out of things, keeps our thinking into the positive light. Glass जो half full है, वो half full दिखाने वाला जो positive perception आता है, it's because of serotonin.
Okay.
Now what happens, maybe due to some genetical reasons, or maybe continuous stress and anxiety which is there for months altogether, these can impact the level of serotonin in the brain. The moment serotonin level decreases, a person starts to feel more negative, low, is not able to draw pleasure out of things, the sleep disturbs, hence a person lands into depression.
Okay, great. So last question, any tips or any suggestions that you would like to give to our audience and or to young adults or parents, how can they manage when they see somebody in their family is going through something, or any techniques or anything to manage their loved one?
The most important thing which I would like to request my audience is, please do not be afraid to go see a mental health professional. Please do that, because an expert in this field can help you a lot better than any random person. I have seen, people going to general physicians, people going to surgeons for the matter
People
of
are
that.
basically going on social media to see the treatments and not coming to a professional.
Yes, not coming to a professional. So if you see anyone showing any symptoms of depression, please seek a mental health professional's help. Please do not self-cure, because you do not know the intensity of it, you do not know the severity of it, because there is nothing visible externally. It is all about the internal things which is going on, and that can only be assessed by a qualified mental health professional. So please seek help. And second thing is, I understand because of the stigma associated with it, people usually do not want to, they have so many myths and misconceptions associated with the treatment part.
Yes.
So please don't be afraid. At this point, in this year 2022, we have so many treatment options available with us. It's not just कि यहाँ जाना है, दवाई खानी है, खत्म. Not like that. You have so many options. So many options. Even Ayurveda, homeopathy, these are offering mental health options. Yes.
Treatment for mental health issues, homeopathy also offers.
Yes. Allopathy, please don't hate it, because nowadays we have so many good medicines with us. They don't make you dependent on it. They don't make you drowsy or not disable you to work. Nothing like that happens. Now we have so many wonderful good options with us, which will increase your productivity, which are safe, which don't have many side effects, which don't you will not become dependent on it. All of these things. And then therapies, like we have so many different form of therapies available with us. Not just talk therapy, many different lovely, wonderful forms of therapies are available.
Relaxation, mindfulness, these techniques also help a client to
art-based therapy.
Art-based therapy, yeah. A lot of
sound therapies, like so many different things. but you will only get access to that if you come to a professional for it with your symptoms, signs and symptoms. So please just identify this thing, and if you are or your any near and dear ones, you see any change in their behaviors, their mood, their sleep patterns, or maybe like the conversations like negative thinking or any suicidal ideations or attempts, or at least any voicing about the suicide, please bring your person to a mental health care professional, and then the proper treatment should be started for a person.